Hello, how are you today?
I'm good. How are you?
I'm good. Thank you for coming to
You're welcome.
this interview and having a conversation.
Mm-hmm.
What would you like to talk about today?
I thought we could talk about my profession, if that works.
What is your profession?
I'm a speech-language pathologist.
Okay. Did you go to school, get an undergrad or graduate degree?
For speech-language pathology, you have to, to be a speech-language pathologist licensed in Indiana, you have to go get your undergrad degree in speech-language pathology. Well, it doesn't have to be that. Mine was, though. And then you go to grad school to get your master's. And that is what I did.
Lovely. Where'd you go to school at?
I went to Ball State in Muncie, Indiana, here.
Lovely. Did you live down there with roommates or anything?
Yes, I did. I lived on campus my freshman year, and then I moved off campus. And I lived with roommates then the whole time I was there. I was there 6 years, I think. So, yeah.
Did you have a lot of friends in your practice?
In my major, yeah, I had like 3 really good friends I would study with, sit with in class. You know, we had similar personalities, but I would say by the time grad school came, we were all friends. Like, I would talk to everybody, yeah.
Was there competitive spirit amongst you?
Between my friends and I, we never you never knew you were being competitive with them, but I had one girl I ended up living with in grad school for a while. She would, get a better grade than me,
right.
And I would think, oh man, she got a better grade, I wish I had. Yeah. But it was never we had those types of relationships, no. I wouldn't say
that's good. It'd be difficult to see other people, but that's good. It didn't matter too much.
Yeah.
Mm-hmm. Nice. Where do you work now as a speech-language pathologist?
I work for Parkview. I go between Parkview Whitley Hospital and Parkview Huntington Hospital.
Lovely. Did you ever work in any other setting, or you worked just in hospitals?
This is where I've only worked since grad school. Mm-hmm. For grad school, though, and undergrad, I had clients, we called them then, that we would see at our on-campus clinic that we had. Wow. And then part of my grad school requirement was that I interned at an elementary school, I guess I could intern anywhere. So I was at an elementary school and a high school. And then my other internship was at where I work now. I interned there, and then they created a position for me and offered me a job.
They created a position for you, so you must be very good at what you do.
Well, they did create a position for me. I like to think I'm good at my job. I think I am.
That's really good. Mm-hmm. Do you like to work with any specific clientele age group? Do you have a preference?
I like working with kids the best, I would say, but I like having variety. Right. Like at the elementary school, I worked with only kids, but then I worked with high schoolers and they were special needs, so they're a lot older because they can stay in the schools for longer. But right now, I really like to work with pediatrics. I don't have very many adult patients right now, but yes, I'd say pediatrics.
That's good. Is there a wide spectrum of disabilities that go along with speech disorders or speech impairments?
Well, as far as pediatrics go, some kids just have I'm sure you've heard children before who have a lisp. Right. Or maybe say W's for their R's. Mm-hmm. And those children sometimes don't have any other health problems or diagnosis. They just have a speech delay. Right. So I work with those type of patients, but mostly in the outpatient hospital setting. You get more of the kids who, I see young patients, the age range from 2 to 5, and they, maybe aren't even speaking yet. Wow. Or they have autism, have a trach maybe, they're nonverbal. Right. I'm trying to think of some of my other areas. I've worked with children with Down syndrome and adults with Down syndrome. But you can, pretty much anybody can have speech and language issues. But it's children with autism are the big ones we see, I guess. The majority of my patients do have autism. Yeah.
It's a versatile population you work with.
Yeah, and where I work, I could have, a bunch of kids with autism, which I do right now, but then I could have, none. You know what I mean? A year from now, because I could discharge them, whatever. So it's always changing, and that's why I like where I work, because it's a real variety of patients.
That's good. Mm-hmm. How long does it usually take for you to notice a big impact of your therapy that you're giving them?
some kids, like if it's just straight articulation, so like they can't say an S, some of those kids, especially the ones who are, really into it and really trying and they have a lot of carryover at home, you can see improvement in 6 months. You'll see improvement every month.
Right.
But over like 6 months' time, they'll have met most of their goals and you might be discharging them at 6 months.
Wow.
But a lot of my patients I've been seeing for a lot, like over a year. And some of my patients are like a lifer, you would call it. Like you're going to see them forever until their insurance doesn't let you see them anymore because they'll need speech therapy their whole life.
Yeah. In those cases, is that more to just maintain the capability of speaking and not so much improve from where they're at?
No, you're always trying to improve.
Okay.
Because in the hospital, well, in any setting, your goals are to improve. And if you're not showing any gains, then their insurance won't cover it.
Right.
And nobody can really afford to pay for speech therapy out of pocket. So yeah, you always have to show some sort of gain. It's just those lifers, I guess, they have so many problems that you'll always have different goals to work on. As they get older, they'll run into different problems and you'll just be working with them for a long time.
Oh my goodness. How is working with inpatient? You've been talking a lot about outpatients.
Inpatients are totally different. I've never seen a pediatric inpatient, actually. My inpatients are typically, they've had a stroke, or a lot of my inpatients I get are coming from a nursing home and they think they're aspirating and they have pneumonia, or they're just overall their cognition has changed and mentally they've changed, so they're brought into the hospital, maybe their oxygen isn't good, different things like that. And typically my inpatients are older. I think I've had some who are like middle-aged, I guess, but most of my inpatients are like 70 and above. Like my oldest patient I've had inpatient is late 90s. So it's totally different than my outpatient that's mostly pediatric and sometimes stroke patients and adults. But inpatients, you're always going to get an outpatient, you're always going to get an adult, typically elderly, and they're outpatient, they're coming from their home, so they're not as sick. An inpatient, they're really struggling and having a hard time with whatever's going on with them. So it's totally different.
Right. Is it difficult to make that adjustment in a workday if you go from a kid to an elderly person, or does your social skills, does that just come naturally for you?
For me, I was lucky and it became very natural for me.
That's good.
But I could see that it would be a big problem for people because I've talked to my other friends who are in the field and they're like, oh, how do you do that? Like, wouldn't you rather just stick to one thing? Like, how do you go back and forth and keep up on all the knowledge you should know with going back and forth? And I used to get really nervous when I first started out, because I would hear people saying those types of things. But for me, it's kind of, because I interned there, it's all I've ever known. Yeah. So, it's not hard for me. I enjoy it, actually, because then you're getting away, and these people, inpatients, it's just, they both need you, so you kind of just, you get accustomed to it, I guess, and I know what to do with my social skills and how to change.
Yeah. That's good.
Everything.
You seem like a very extroverted person, so it seems like you probably thrive in that atmosphere.
I am. I would say I'm an extrovert, yeah, I guess. I like to talk, so it's a good or bad thing, I guess.
Well, you've done a nice job holding on this conversation, that's for sure.
Thanks.
Yeah, you're welcome. Well, thanks for talking to me. I appreciate it.
You're welcome. Thanks for asking me these questions.
You're welcome.